Vinaver Medical uses existing infrastructure to treat more cancers and to get approval for this. My name is Stevan. I'm a physicist, and I really get frustrated where great science doesn't apply that well in practice. We figured out how to use charged particles to accelerate them and destroy tumors inside of the body. But at the same time, these advanced centers, are not operating at the full capacity. It's more difficult to get insurance approved for this form of radiotherapy, and that delays the treatment by 5 times. So basically, our company is on path of improving this problem. So we want these centers operating in full capacity. We want to reduce the insurance rejection rates and therefore reduce the time. So how we actually do that? So we figured out that the key to this is actually CT imaging, because the way you get the approval for this treatment is by doing the CT and making treatment plan that is much better than other alternatives. And it's interesting because CT is now under revolution from the side of the detector point, and big companies are making new CT equipment, and we have developed proprietary AI software that utilizes this hardware and improves the accuracy of treatment planning in partial therapy. So this market is, I would call it beachhead market, 90 million. I like the number, and we kind of have good connection in this market. But the follow-on market, which is pure medical diagnostic imaging market, is much bigger, and we'll try to enter that market at this following. So here we have designed really, in my opinion, good strategy to go to market. So we're using the existing spectral CT equipment from big guys, from big vendors, and then we're integrating on the other side into treatment planning software that they are already using, right? So our added value here is AI post-processing that perfectly integrates here and doesn't change the way operator is using the software. Business model is value-based pricing model. So each patient that gets approved because of increased accuracy of our software, we take some percentage. This is the initial model, then it will translate to a subscription model. We have evaluated what is important for customer. They want to be able to integrate to the software, to the CT that is there, and then they want high accuracy. And in this area, we provide an advantage. Roadmap, we have 178 grants so far. And from the development point of view, we have really strong connections and collaborations for research with Duke University in the US, and for prototype testing that we are currently doing as a preclinical testing we're doing with the Erasmus MC Hospital, which is one of the biggest cancer hospitals in Europe. You're looking for $500,000 for finishing our ID and clinical trial plan. As for the team, just really quick, 3 physicists, our end user in the team, and then we also have an engineer, and I take our role of business development for this team. Thank you so much, Rui.
We're really the first here from the others, because you cited some competitors, but we know maybe also more competitors. So really, what is your main value?
So the main value is actually that we're using this new technology that they have developed for diagnostic primarily. We figured out that this can be, we can improve the particle development with this. And the other big advantage is that we can integrate. So if you have Canon, Siemens, GE, CT, you can use that. So you don't have to buy a particular CT. So we improve the accuracy with no cost, with no additional hardware cost to the hospital or to the particle centers in this case.
I can go from about set of who's the only revenue. Because I supply trees government something. How do you measure any more value? So with the improvement, you say that it becomes more sensitive.
Yeah.
How do you measure that so that people may want to buy it over any other?
That's a really good question. So we're focusing on US and Europe. Europe has different ways of comparing how much orthotherapy is better than other therapy. Then we have really quantitative measure. You do the plan with and without our software, and you see the dose deposition. And then you basically know, when you do the subtraction, you will see how much more dose goes to healthy tissue with the previous solution and how much less is there with the new solution. So you kind of really obviously see that.